One tick bite can make a hamburger trigger a serious allergic reaction hours after dinner. The tick is the lone star tick. The missing connection is alpha-gal. Picture yourself walking beside a brush line, clearing weeds, or spending an afternoon near the edge of the woods. Later, you find a tick and remove it. The bite may itch, but the encounter seems finished. Then, weeks or even months later, you eat beef, pork, or another mammal-derived ingredient and develop hives, stomach pain, swelling, or something more serious. Not right away. Hours later, long after the tick has left your mind. The tick and the meal can be connected. In some people, a lone star tick bite is associated with an immune change called alpha-gal syndrome. The tick itself disappears. The biological effect may remain. The lone star tick is Amblyomma americanum. Its name comes from the pale spot on the back of an adult female. That spot can help with identification, but it is not a complete field mark. Adult males have pale markings around the edges of the body rather than one obvious central star. Immature ticks may have no star a person can readily see. So, can you identify every lone star tick by looking for one white dot? No. That dot points most clearly to an adult female. Males in young stages look different, and the smallest stages can be extremely difficult for a non-specialist to identify. Lone star ticks actively seek hosts. They do not always wait indefinitely for an animal to brush against the exact piece of vegetation beneath them. They can detect cues from a potential host and move toward it over short distances. In the United States, they are established across much of the southeast, south-central region, and eastern states. Their recognized range now extends beyond what many people still consider traditional lone star tick territory. Identification tells us which tick is strongly associated with the syndrome in the United States. It does not tell us how a bite can apparently change someone's response to dinner. The first misconception is that the tick injects a finished food allergy, almost like an infection passed intact from the tick to a person. That is not what happens. The tick does not put beef allergy directly into the bloodstream or transfer a ready-made reaction. Exposure connected with the tick's saliva can sensitize the immune system to one particular molecule. That molecule is galactose alpha-1,3 galactose, usually shortened to alpha-gal. It is a sugar found in most non-primate mammals. Cattle, pigs, sheep, and deer have alpha-gal in their tissues. Humans and other primates do not naturally produce it in the same way. Researchers are still studying exactly why this happens, but a tick bite can push some immune systems into treating alpha-gal as a threat. The body may start producing a type of allergy antibody called immunoglobulin E against the sugar. Immunoglobulin E is often abbreviated as IgE. Once those antibodies are present and attached to allergy-related immune cells, another encounter with alpha-gal can trigger a reaction. That is the real reversal. The bite may leave more than an irritated patch of skin. In a susceptible person, it can help establish an entirely new immune target. Follow the sequence closely. A lone star tick attaches to the skin and feeds. As it feeds, saliva enters the bite site and interacts with the immune system. In some people, that encounter is followed by the production of alpha-gal-specific IgE antibodies. Eventually, the tick is removed or drops away. Then time passes. Later, that person eats beef, pork, lamb, venison, or another food containing enough alpha-gal to activate the sensitized immune system. The food first has to be digested. Alpha-gal-containing material then has to be processed and absorbed. When the relevant molecules reach immune cells carrying those antibodies, the cells can release inflammatory chemicals. Those chemicals cause the familiar signs of an allergic reaction: itching, hives, swelling, digestive distress, breathing problems, or changes in blood pressure. Bite, sensitization, meal, delay, then the reaction. That timing separates alpha-gal syndrome from many familiar food allergies. A peanut reaction, for example, may begin within minutes. Alpha-gal reactions commonly begin several hours after exposure. Current guidance from the Centers for Disease Control and Prevention says symptoms often appear roughly 2 to 6 hours after eating food containing alpha-gal, although the timing can vary. Why such a long wait? Digestion and the transport of alpha-gal-containing molecules, particularly those associated with fats, appear to play important roles in the delay. Scientists have not reduced every case to one perfectly settled timing mechanism. But the pattern is clear. This allergy often stays quiet while the plate is still on the table. That delay creates a diagnostic trap. Someone eats dinner at 7, goes to bed feeling normal, then wakes later with hives or severe stomach symptoms. The latest snack may get the blame. A detergent may look suspicious. The meal from hours ago may not. And a tick removed weeks or months earlier can seem completely unrelated. The symptoms can go far beyond a rash. According to the Centers for Disease Control and Prevention, alpha-gal syndrome can cause hives or an itchy rash, nausea, vomiting, severe abdominal pain, diarrhea, coughing, breathing difficulty, dizziness, swelling of the lips, throat, tongue, or eyelids, and a drop in blood pressure. It can also cause anaphylaxis, a potentially life-threatening allergic reaction requiring urgent medical attention. Even the same person may not have the same reaction each time. The amount and form of alpha-gal exposure can differ. Exercise, alcohol, some medications, and other factors may affect reactions in certain patients. Individual sensitivity varies too. One episode may cause digestive symptoms, another may cause hives or a more serious combination. The boundary matters as much as the warning. A Lone Star tick bite does not guarantee alpha-gal syndrome. Many people are bitten and never develop it. The association is real and the reactions can be serious, but a bite is a risk factor. It is not a diagnosis. The phrase meat allergy is useful because red meat is the best known trigger, but it does not tell the whole story. Alpha-gal occurs in materials derived from non-primate mammals. Beef, pork, lamb, and venison are clear examples. Organ meats can contain it too. Some people with alpha-gal syndrome also react to dairy products, gelatin, or mammal-derived ingredients in foods. Certain medications and medical products may contain alpha-gal or mammal-derived components that matter to some patients. Mammal-derived is the category to remember. Mammal-derived food. Mammal-derived ingredients. And in some cases, mammal-derived medical materials. That does not mean every affected person reacts to every item in the category. Some tolerate dairy. Some react only to particular foods or amounts. Sensitivity can change, and ingredient lists do not always reveal the biological source clearly. This variation is one reason professional evaluation matters. Poultry and fish do not contain alpha-gal in the same pattern as non-primate mammals. Reptiles do not either. This is not an allergy to all animal protein, and it is not a reaction to everything people call meat. It is an immune response to one particular sugar found in one particular biological group. So what does this mean after an ordinary afternoon near a yard or wooded edge? Begin with tick prevention. When you enter brush, tall grass, leaf litter, or wooded margins, follow current public health guidance for protective clothing and approved tick repellents. Afterward, inspect your clothing and skin carefully, including areas that are harder to see. Showering soon after coming indoors may help you find unattached ticks, but it does not replace a thorough check. If you find an attached tick, remove it promptly using clean, fine-tipped tweezers. Grasp the tick as close to the skin as possible, then pull upward with steady, even pressure. Do not twist it, burn it, cover it in petroleum jelly, or use another improvised method meant to force it to detach. Once it is out, clean the bite area and your hands according to current health guidance. Those steps reduce the risks associated with ticks generally. They cannot tell you whether alpha-gal sensitization has taken place. What helps next is awareness, not assumption. If delayed allergic symptoms repeatedly follow beef, pork, lamb, venison, dairy, gelatin, or another suspected mammal-derived exposure, note what you consumed and when the symptoms started. Prior tick exposure belongs in that history, even when the bite seemed minor or happened months earlier. Bring the timing, the food pattern, and the possible tick encounter to a qualified medical professional. Severe symptoms are different from a pattern you can watch at home. Difficulty breathing, significant swelling of the throat or tongue, faintness, or other signs of a severe allergic reaction require urgent medical attention. A wildlife explainer cannot determine whether a particular reaction is alpha-gal syndrome. No one should delay emergency help while trying to work out that connection alone. Caution makes sense, certainty does not. Not every delayed stomachache after a hamburger is alpha-gal syndrome. A tick bite by itself does not establish the diagnosis. Even a blood test showing alpha-gal specific IgE has to be interpreted alongside symptoms and exposure history. Some people may have detectable antibodies without a clinical pattern that confirms the syndrome. A medical professional must evaluate the full picture. The geographic claim needs a boundary too. In the United States, the Lone Star tick is the species most strongly associated with alpha-gal syndrome, and reported cases are concentrated heavily within or near its established range. In other parts of the world, different tick species have been connected with alpha-gal sensitization. The Lone Star tick is central to the American story. It is not the only tick implicated everywhere. Researchers still have important questions to answer. They know tick exposure can be associated with the development of alpha-gal specific antibodies. They know the syndrome can cause delayed allergic reactions after relevant exposure. They are still investigating why one bitten person becomes sensitized while another does not, why reaction thresholds vary, and how additional tick bites may change sensitivity over time. That uncertainty does not erase the practical rule. It makes the rule more precise. Go back to that first encounter. Once the tick is removed, it is easy to believe the event is over. But the tick's disappearance does not make the exposure irrelevant. Weeks later, symptoms appear several hours after a mammal-derived meal, making the food easy to dismiss. But a delayed connection is still a connection. The tick matters. The meal matters. So does the delay. Prevent attachment when you can. Remove attached ticks correctly, and remember the encounter. If a delayed, repeatable allergic pattern appears after mammal-derived foods or products, seek medical evaluation and mention both parts of the story: what you consumed and whether tick exposure may have occurred. We expect cause and effect to arrive together. A bite hurts now. A food reaction begins within the first few bites. Alpha-gal syndrome can place weeks between the bite and the new sensitivity, then hours between the meal and the reaction. Ordinary time hides the connection. Take a Lone Star tick bite seriously, without assuming every bite creates an allergy. Notice the delayed pattern without trying to diagnose it yourself. And if that pattern includes serious allergic symptoms, seek appropriate medical attention. That is what makes this tick different. The encounter may last only a short time, while the clue can arrive much later.